The New Zealand Blood Service Reference Laboratory based in Auckland provides a 24/7 immunohematology referral service to the blood banks, hospitals and community laboratories of New Zealand. A wide range of investigations are undertaken by the laboratory.
We receive blood samples from the hospital blood banks, clinics, community laboratories and donor accreditation, and these can be routine testing or more complex, which falls into the reference lab. Our main work is grouping and antibody screening, and more complex cases we receive that other laboratories haven't got the resources for, which requires getting cells out of liquid nitrogen. Being a reference lab, we carry a wide range of identification panels, so we do have an extension to what other laboratories do have.
Other important services include the provision of medical and scientific advice and preparation of the National Immunohematology Quality Assurance Program, the NIQ-AP. The laboratory is part of a worldwide network of laboratories and plays a vital part in the resolution of challenging or complex cases.
I really enjoy the work. I think with my department it's hands-on work. Also the work itself, you don't know what the day is going to bring. The complex cases are very interesting to get into, and at the end of it, it's the safety of the patients that's the priority. We're all a good bunch in there and we do get on, and over the years I've found that staffing is what makes NZBS, and it makes it a good place to work.
The National Tissue Typing Laboratory, based in Auckland, is responsible for tissue typing tests in support of New Zealand's bone marrow and solid organ transplant programs to test for compatibility between patients who require an organ or bone marrow transplant and potential donors.
In tissue typing, we test for bone marrow transplants and also solid organ transplants. That's the main purpose of our lab, but we also do disease association testing. At the start of the day, we receive samples from patients and donors and sort them out into what kind of testing is required. So we do a variety of tests. So we do DNA department that extracts DNA and works out what the tissue type of the patients and donors are. And we've got a serology department where we do all the antibody testing. We also test for disease associations, such as ankylosing spondylitis and celiac disease. And we also do some NATE cases, which is neonatal autoimmune thrombocytopenia, and refractory cases as well.
Testing for compatibility may involve matching patient and donor tissue types, and it may also involve antibody screening or cross-matching to ensure the patient doesn't have an antibody directed against donor tissue type. These tests are performed by a dedicated team of medical laboratory scientists who are proud to make a difference.
It's a great team and we all work hard together to get the job done, because it's great to be able to contribute to making an improvement in a patient who's about to receive a transplant and their quality of life.
Both of these laboratories are focused on delivering high-quality services to DHBs, private health providers and patients around New Zealand.
Safety is our cornerstone at New Zealand Blood Service, and we are handling samples safely to ensure that we're testing the right patient for the right test, and also that we're looking after ourselves.